I hope I can be as energetic as Jack, but I would like to thank John Rother and his whole team at the National Coalition on Healthcare for the effort that they devoted to this really detailed and extremely helpful proposal. ARP welcomes this initiative. Rising healthcare costs are a growing burden for all Americans, but particularly for older Americans. And we share NCHC's goal of bringing down healthcare costs with strategies that improve the delivery of care and lead to better outcomes for patients. I believe it's critical that we explore opportunities that actually bring down the cost of health care and not merely shift it to patients and their families. ARP is not endorsing specific proposals today as we continue to develop our own agenda for addressing healthcare costs, but we certainly support the broad goals NCHC has outlined. The National Coalition's Plan for Health and Fiscal Policy has a number of common sense proposals to increase the quality of care and reduce spending. And I'd like to highlight just a few, which are by no means the best, but just wanted to highlight a couple of them. First, we agree that it's critical to create incentives to reward value and effectiveness for healthcare providers. Currently, we pay providers whether the care is right, whether it's necessary, or whether it isn't. We should be paying for quality and certainly not for mistakes. We support payment strategies that encourage effective care, not merely the volume of treatments. Hospitals should also be held accountable for the care that they provide. We shouldn't pay for preventable readmissions or healthcare acquired affections. Second, more needs to be done to bolster the primary care workforce. Older Americans are more likely to have multiple chronic conditions that require repeated and complex interactions with healthcare system. As the population ages, we desperately need to expand the number of physicians and other clinicians with primary care and geriatric training. We also have to make better use of the skills of all health professionals. This includes expanding the pool of highly skilled nurses who can play a valuable role in team-based primary care that is coordinated and patients are supported. We agree with the report that this would be a game changer. Third, we need to reduce costs and encourage more competition, and that's especially true in the market for prescription drugs. Making more drugs available at lower costs is an important strategy to keep care affordable for consumers. Generics have enabled many people to pay for essential treatments, but there's more we should do. One valuable step would be to speed up the availability of generic biologics or biosimilars, which are protected from competition for 12 years. These drugs are made in living cells and increasingly used to treat cancer and other serious illnesses. But they're very expensive. Reducing the time before generic could compete would be enormously helpful in making these promising new treatments more affordable. Another cost-saving step would be to eliminate incentives that encourage the use of brand-name pharmaceuticals over generics. We see this in Medicare Part B, where distorted incentives encourage providers to use the highest-priced drugs. These are just a few of the many good ideas within the NCHC's proposal. As you know, at ARP, our central focus is the consumer. So I'd like to use my remaining time to share with you the realities that our members face as they try to navigate the healthcare system. We believe that proposals that keep these points in mind will have a much better chance of succeeding. First of all, many older healthcare consumers are already stretched financially, and they can't afford to pay much more. They need more value for their healthcare dollars, not higher bills. To give some context, the majority of older Americans, particularly the oldest Americans, have modest income. In 2010, the median household income for families aged 65 to 69 was only $32,000. By age 80, household income averages less than $20,000. Surviving on $20,000 is particularly hard when a large share of your income is consumed by health expenses. And we know that half of all Medicare beneficiaries spend 17% or more of their income on out-of-pocket costs. And that percentage rises considerably as people age or their health declines. As we debate the impact of rising health costs on the federal budget, we must also recognize that the impact of these will have on consumers. It's estimated that by 2035, Medicare beneficiaries in poor health will spend nearly 40% of their income on out-of-pocket health expenses. Jack's point is also true about younger workers as well. Why does this matter? Well, when healthcare costs too much, people stop taking prescriptions that they need or forego treatments that can lead to higher costs down the road. The notion that consumers who have, quote, more skin in the game make more cost-effective healthcare choices is often dubious. People avoid the doctor when out-of-pocket burdens get too high. They don't fill or renew their prescriptions. They cut their pills in half. The Kaiser Family Foundation found that 58% of Americans were delaying going to the doctor or dentist to save money. And people say they were doing things like taking home remedies or buying over-the-counter drugs instead of getting the care that they needed from their doctors. And there's compelling evidence to say that people are not just skipping the necessary treatments, but also the unnecessary treatment, but also those that are necessary. So in conclusion, I want to emphasize that healthcare costs can't be effectively addressed in the budget framework alone. Blunt, across-the-board cuts that just shift costs elsewhere could potentially create new health problems for individuals or our system as a whole. The real goal here is to contain costs in a meaningful way by creating a more efficient and effective healthcare system. In other words, we can both save money and improve care. That kind of cost containment would be good for seniors, good for young people, good for the US budget, and good for the entire economy. The kinds of goals that the NCHC has outlined today in this plan are just the sort of strategies that we need to be examining. It's critical that we find out what really works to control costs and improve care and use those lessons to make a better healthcare system. Thank you.